Hello and welcome to Askimo TV. I'm talking today to Dr. Julian Rowe-Jones. Dr. Rowe-Jones is a consultant nasal surgery specialist at Royal Surrey County Hospital in the UK and director of the nose clinic. Hi, Dr. Rowe-Jones.
Morning.
Dr. Rowe-Jones, we're going to talk today about nasal polyps. What are nasal polyps?
Nasal polyps are grape-like swellings that arise from congestion in the lining of the nasal sinuses that then hang down into the nose and most often cause problems such as nasal blockage, running, watering from the nose, and problems with sense of smell and taste.
What causes these polyps and who's at risk for getting them?
We really aren't sure, in fact, of what causes polyps. It may well be that one day we discover that there's a gene responsible that makes those patients more sensitive in their sinus lining to things that we breathe in that don't bother anybody else. Certainly the group that's most at risk of developing polyps are patients with asthma, so we know they have oversensitive lung lining, and as the nasal and sinus lining is very similar to the lungs, they are prone to polyps as well.
What are the signs and symptoms of this condition?
Symptom-wise, most patients say they feel like they've got a constant cold, their nose is blocked, their head feels full, and often the nose runs. And then when I look inside the nose, which often requires a special camera or telescope, an endoscope, I can see these grape-like swellings inside the nose. And sometimes if they're very big, they actually come down to the nostrils.
What can happen if it's left untreated?
The main issue is that the patient's quality of life is just constantly compromised. As I say, they feel like they've got this constant cold. It affects their ability to sleep. Their sleep quality is poor. Their work productivity diminishes. And it really is a significant quality of life issue. Some patients also get recurrent sinusitis infections on top of everything else with pain and fever and so on, although that's more rare.
And what sort of treatment options are available for nasal polyps?
Our goal with polyps is, as with asthma, which is to control what is a long-term condition and to restore a high, good quality of life. All patients will need ongoing medical treatment with nasal sprays, which are a bit like asthma inhalers. But if these aren't getting on top of things, then surgery, keyhole surgery in the nose is undoubtedly the most effective treatment.
Tell me a little bit about the surgery and what is the prognosis for recovery after the surgery?
Surgery is looking to very carefully, with minimal invasion, using telescopes and cameras and screens, operating screens, to remove the polyps whilst leaving the normal areas intact. Sometimes it can be like picking grapes off a bunch, but at other times you've got to sculpt the inside of the nose. We can now use balloon technology to help open up the sinuses too, the so-called balloon sinuplasty. And my goal is always to achieve the maximum effect with minimal invasion or minimal irritation for the patient. Most of the time I'll do this under general anesthetic as a day case, and the patient goes home the next day, probably has 24 hours off work, maybe 48, depending on the extent of the surgery required. And then they should notice a difference very quickly.
Thank you, Dr. Rowe-Jones. Thank you so much for talking to me today.
You're welcome.